Yeah, this was a very interesting work that one of our MD Anderson fellows, Dr. Julie Braish, actually decided to look at. There are data about the role of splicing mutation in patients with myelofibrosis, where we know there are two high-risk splicing mutation, particularly the U2AF1, Q157, and then the SRSF2. The rest of them were always considered a low risk with no impact on survival. However, this has been established in the primary myelofibrosis. So when we decided and asked about how does this play in post-ET, post-PV MF patients, and then what is the interplay with high-risk molecular mutations outside of the splicing, such as IDH mutations, EZH2 mutations, and so forth. So what we found in a cohort about 114 patients that had full molecular sequencing at MD Anderson with a shorter period of time, then actually the distribution of the splicings is slightly different, which we were kind of expected that we confirm it, where people with primary myelofibrosis have more of the higher risk mutations, particularly SRSF2, and then patients with the post-ET, post-PV had more of the lower, particularly very interestingly, there was a huge incidence of SF3B1 of these patients. We haven't noticed any difference in survival, so similar mutations with similar subtypes kind of gave us very similar outcomes, so that was one thing that we checked, like we could use this across the board. And then in terms of the impact of high molecular risk mutations, interestingly so, we haven't seen the shorter survival in U2AF1 mutated patients. However, we did see the shorter survival in SRSF2. So SRSF2 came as the worst, regardless of the additional high-risk molecular mutations. So currently we are looking more into the role of therapies, particularly JAK inhibitors, and stem cell transplant, and some more details what could have impacted the outcome. And of course, we'll need a longer follow-up, because the longest follow-up in the cohort was about 33 months, so not even 3 years. But there are additional data that shed lights onto how these high-risk mutations could impact the outcome of our patients, and I think that would be very important for decision making for the future.